So health policy classes have been pretty dry in academia. Do a policy analysis, which when you tell a student to do that, they really don't know what you're talking about. And I've decided that's a totally inappropriate assignment for an undergraduate or even a graduate student. But just there's so many more ways you can be involved in advocating for health policy. Also, nurses understanding how important it is to be involved in it. Like so many things that they do, taking care of patients, are based on legislation. People that are doing research, that money probably came from a piece of legislation, and you should understand why and what is the goal of that, not just to get a publication out of it, but what is the big picture you're trying to move forward.
I have a course that I have for graduate students that I teach for health policy, and it has a 3-day intensive. I started including a lot of the people in my cohort, people that I had met from organizations, having the students to go and look at hearings and markups throughout a semester. They're tracking state bills, they're tracking federal bills, they are analyzing, and I increase the level of policy analysis in my classes.
And one of the things I learned actually, is teaching the concept of political competency, because one of the things I learned a little bit was how the political system works and how you can be a competent actor to that. So I actually run courses at the university, and I'm a guest in the nursing school and the biomedical sciences and the medical school to teach about how the health system works, how the political system works, and how you can be a more effective advocate.
I think what it made me realize doing this fellowship, and particularly the interaction with the analysts at the CBO, is how important that clinical voice is, and people don't hear it. And if we're not there, if we're not at the table, then those decisions get made for us, whether we're there or not. And it's just important for us to be there. And I don't think we're not training our medical students, or our residents, or trainees to really take that focus. But now, as I come back into the practice and I speak to the residents, trainees, they're very interested, I think much more than when I was in training. There's this hunger for education and how they can be involved. And I think this generation is realizing how important it is for them to be involved in it. It's something that maybe people who trained when I did, we just didn't think of it. And I want us to start taking a much more active role.
Most of my students are terrified. They're terrified of policy. They see what they see on the news, which is that no one gets along. There's these like large echo chambers. There's this group, there's that group. They're scared they're going to say the wrong thing. They're going to not feel informed. And so I try to just level set with my students and have them, they're already sort of doing a lot of advocacy, but they don't realize it. I try to redefine policy in a way that makes it accessible in ways that I learned from the fellowship. So don't just think of you've got to write this big brief and you're submitting it to someone and that's going to change the world. That's a pretty high stakes situation. So I try to break it down. Just think about a conversation you've had with someone you care about, or you're trying to change someone's mind about something. Everyone has an example of that, everyone. And so that's where I start at the basic level, and then I talk about, and we sort of build from there. And then they usually get pretty excited when they see like, okay, I actually might have some skills to do some of this now, and I like it, and I think this is fun, and I might actually be able to make a difference. And then I usually give them examples of ways in which they can make differences or contribute to some sort of policy change effort in the spaces that they're in. At the beginning of the class, most students are very terrified, and a little bit, they're not thrilled to take the class, but then by the end, almost everyone is very excited. They're like policy folks. They've got tools to contribute in different ways, and that feels pretty meaningful. So I think that's been an exciting way to get students excited about policy.